Hi and welcome to our telehealth video information series. I'm Garvin and this video is on Zoftacot. So what is Zoftacot? Zoftacot are eye drops, solution in single dose containers. The solution is a practically clear, colourless to slightly yellow solution and free from particles. So what is Zoftacot used for? It's used for the treatment of mild, non-infectious, allergic or inflammatory conjunctival diseases. The recommended dosage is 2 drops 2 to 4 times a day into the affected eye. The duration of this dosing regimen will vary from a few days to a maximum of 14 days. Gradual tapering off up to 1 administration every other day may be recommended in order to avoid a relapse. In case of insufficient response, a more potent corticosteroid should be used. And for the method of administration, it's for ocular use only. A single dose container contains enough solution to treat both eyes and for single use only. This medicinal product is a sterile solution that does not contain a preservative. The solution from one individual single dose container is to be used immediately after opening for administration to the affected eye. Patients should be instructed to avoid contact between the dropper tip and the eye or eyelids and to use the eye drops solution immediately after first opening of the single dose container and to discard the single dose container after use. In case of concomitant treatment with other eye drops, the solution installations should be spaced out by 5 minutes. And for contraindications, hypersensitivity to the active substance or any of the excipients. So known glucocorticosteroid-induced ocular hypertension and other forms of ocular hypertension, and acute herpes simplex virus, and most of the other corneal viral infections at the acute stage of ulceration, and conjunctivitis with ulcerative keratitis even at the initial stage, and ocular tuberculosis and ocular mycosis, ocular purulent infection and purulent conjunctivitis and blepharitis, and aggravated by anti-inflammatory drugs. So they're the contraindications. And for precautions for use, topical steroids should never be given for an undiagnosed red eye. Use of this medicinal product is not recommended for the treatment of viral herpes keratitis, but it may be used if required only with a combined antiviral treatment and under close supervision of an ophthalmologist. Thinning of the cornea and scleria may increase the risk of perforations with the use of topical steroids. Any fungal infection should be suspected in cases of corneal ulceration where a steroid has or had been used for a long period. Patients should be monitored at frequent intervals during treatment with hydrocortisone eye drops. Prolonged use of corticosteroid treatment has shown to cause ocular hypertension, glaucoma, especially for patients with previous IOP increase induced by steroids or with pre-existing high IOP or glaucoma. So the use of corticosteroids may also result in opportunistic ocular infection due to the suppression of host response or to the delay of their healing. In addition, topical ocular corticosteroids may promote, aggravate, or make signs and symptoms of opportunistic eye infections. Wearing of contact lenses during treatment with corticosteroid eye drops should be avoided. And the interaction with other medicinal products, so no interaction studies have been performed. For fertility, pregnancy and lactation. For pregnancy, Zoftacot is not recommended during pregnancy unless absolutely necessary. And for breastfeeding, systemically administered glucocorticoids are excreted in breast milk and may cause suppression of the growth or endogenous corticosteroid production or may have undesirable effects. It is not known whether Zoftacot is excreted in human milk. A risk to newborns and infants cannot be excluded, so therefore should be avoided. And for fertility, there are no data on potential effects of hydrocortisone sodium phosphate on fertility. The effects on the ability to drive and use machines. No studies on the effects on the ability to drive and use machines have been performed. Temporarily blurred vision or other visual disturbances may affect the ability to drive or operate heavy machinery. If blurred vision occurs, the patient must wait until the vision is clear before driving or using machines. So the side effects would be burning and stinging, may occur immediately after installation. These events are usually mild and transient and have no consequences. So that brings this telehealth video to an end. If you have any questions, you can leave them in the comments below or contact me through our website, mytelehealth.info, or call into Lynch's Pharmacy in Douglas, Cork, or ring 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.